We are the Childhood Collective, and we have helped thousands of overwhelmed parents find joy and confidence in raising their child with ADHD. I'm Katie, a speech-language pathologist.
And I'm Lori.
And I'm Mallory, and we're both child psychologists. We combine the science of ADHD with the compassion of moms and bring you practical tools you can start using today.
So hit subscribe and let's help your family shine with ADHD.
You love your child to the moon and back, and you've noticed that your child is having difficulty focusing, or maybe they seem distracted by the smallest things.
Yeah, and despite everyone's best efforts, homework, bedtime, morning routines are taking hours to complete.
Or maybe your child is struggling to stay seated at dinner or at the desk, and maybe the teacher's letting you know that they're talking way too much during class.
Oh my gosh, it sounds like me when I was in grade school.
In grade school?
Okay, in grade school and in perpetuity. Thank you, Mal.
In all of our meetings. We love you,
You're
Katie.
welcome, guys. Thank you.
After concerns from yourself and teachers, you finally make the decision to get an evaluation for your child for ADHD. But after doing a quick Google search, you're finding it's really hard to decide which specialist to go to. There are way too many options. Hello, overwhelming confusion.
Absolutely. But we don't want you to stress. We have got you covered. Today on the podcast, we are going to be helping you navigate the overwhelming process of getting your child evaluated for ADHD. We're going to be sharing 5 of the most common specialists we see evaluating for ADHD, as well as the pros and the cons of those specialists. So let's dive in.
Great. So the first one that we want to talk about is your child's pediatrician. And an interesting statistic is that about 50% of kids with ADHD are first diagnosed by their pediatrician. And there's a lot of reasons for this. First of all, as a parent, you probably already have a good relationship with your pediatrician. You trust them. You go there probably too often if your kids are getting sick. And they're just generally the first person that you think of when your child has an issue. So you already have been talking with them about your child's development, other questions that you have. And so it feels like a really comfortable place to start. Typically, what that process is going to look like with a pediatrician is that they are going to give you rating scales. And these are forms that you would complete about your child at home. And a lot of times they'll give you rating scales for your child's teacher to complete as well. And one of the most common ones is called the Vanderbilt, but there might be another one that your child's pediatrician's office uses.
Yeah, just to kind of jump in, a rating scale is just statements that you're rating your child, like how often they do something. So they have trouble staying seated, never, sometimes, often, always, that type of thing.
Exactly. That's a great clarification. And so parents really tend to like this format for first getting that diagnosis because 1, it's accessible, and 2, it's also much more affordable. Oftentimes with the pediatrician, you're just paying a copay, and so it's a lot easier. And then the other part of that evaluation can be that the pediatrician may ask to speak with you more privately without your child in the room and ask you questions, things about how your child does with keeping their things organized and how they do with emotion regulation and what things you've noticed that are sort of prompting you to ask these questions. So there's a lot of pros to this strategy of using your pediatrician.
And you can get in usually pretty quickly to get that evaluation done. So usually you can get appointment, once you call within a couple of weeks, I would think.
Definitely. And if you do get the diagnosis of ADHD and you are interested in pursuing medication, your pediatrician will often be the person who coordinates that. And so you're already kind of in that dialogue with them, and then you can start trying out medication if that's what you and your family decide works best for you. So there are some cons to this type of testing, and the main one is that your pediatrician is not doing a comprehensive evaluation to look at other diagnoses. So we know that the vast majority, about 80% of kids with ADHD, have additional diagnoses as well. Things like learning disorders, anxiety, depression, autism. And so pediatricians typically are not looking for all of those things. If they have concerns about more other diagnoses, they will often refer you out to a specialist.
Yeah. And I think one thing that I've noticed um, as kind of the specialist that get some of those referrals when they're more complex situations. If you go to your pediatrician first and they have you or your teacher fill out rating scales, some of those questions that they ask tell you whether or not they might need more of an evaluation in a certain area. So if your teacher is maybe saying on that rating scale, oh, they're below average in reading compared to other kids, or in math, or that they're really having a hard time interacting with peers at school, that could be related to ADHD, but that could be a social issue that's maybe related to autism or something else that's going on. So sometimes those screeners that the pediatrician does can give you a little bit of insight if there are other things going on that need to be evaluated.
Mm-hmm. And I think most pediatricians do a good job of helping families kind of know what their comfort level is when it comes to their comfort level with evaluating for ADHD, their comfort level with managing multiple medications. So, at least in our area, I see a lot of pediatricians that are comfortable with managing one medication, one psychiatric medication. Once maybe there's anxiety in play and you and your pediatrician are considering medication for that or whatever it is, once medication gets a little more complicated, that's when I see a lot of pediatricians saying, let's bring in a specialist to advise you and help you with this. But pediatricians are a great point person. And like Lori said, they're generally easier to get in touch with, helpful when it comes to med management, getting faster appointments. So they can be a real great first point person for families who are first having concerns about their child.
Yeah. And I think, every pediatrician is going to be different in their knowledge and experience with ADHD. I know when Mallory and I used to work together as psychologists, and we have, evaluations we both worked on together, we had a pediatrician we worked with who would go to IEP meetings with his patients and had a really significant interest in ADHD and supporting those families. And he did a lot of continued education in that area, much more than other pediatricians. So some feel comfortable doing that and doing those evaluations. Some pediatricians don't and are going to immediately refer you out for that.
That's a great point too. So big picture, a pediatrician is a great point person to start with. And depending on what's going on with your child specifically and what you're looking for, and then what the pediatrician sees, they might be able to just go forward with that diagnosis, or they might refer you out for additional testing, something like a developmental pediatrician, Lori.
Yeah. So the second specialist that often will do ADHD evaluations is a developmental pediatrician. A lot of families haven't necessarily heard of this type of specialist, but developmental pediatricians are similar to pediatricians, have a very similar amount of training. They're medical doctors, so they can do medication management and things like that. But they have more specialization and training specifically in those childhood diagnoses of anxiety, ADHD, autism, depression, things like that. So they have more of a specialization in those childhood diagnoses compared to a pediatrician. So they are, again, a good point person. And I would say, like at my child's pediatrician's office, they usually refer to a developmental pediatrician if there are concerns about ADHD or autism or things like that. So that's kind of their go-to, is looking to get a little bit more of a specialized evaluation by that pediatrician. It's usually covered by insurance, but not always. So that's something to look into, whenever we're making these decisions about specialists, like we want to think about finances. Some of the drawbacks, again, to this testing is really similar to a pediatrician, in that they can't do those comprehensive evaluations for things like a specific learning disorder or dyslexia. Again, we know that around half of kids with ADHD are going to have learning challenges. So a lot of times those two things go hand in hand. So that's kind of a limitation of that type of an evaluation. Again, if there are more kind of complex kids with more nuanced skills and strengths and challenges, they might not feel comfortable making a diagnosis. And again, they might need to refer out for more in-depth testing. Those appointments, at least in our area, when we refer to developmental pediatricians, are usually about 90 minutes long, include parent interview. They might observe your child in the office during that time. And again, they're going to do rating scales with you. They're going to do rating scales with the teacher, very similar to a pediatrician.
I think another drawback potentially, at least in our area, is that developmental pediatricians are in high demand.
Yeah.
And they have very long wait lists generally. This may not be the case in your area, but we see wait lists sometimes more than a year. That's a long time to wait when you have concerns about your child's development, when they're struggling in school. So that's, still make that call, still seek that support out if you feel like this person is like the natural next step, but it can be challenging to get in with them in a timely manner.
Yeah. And part of that is because once you go through that evaluation process with the developmental pediatrician, let's say your child does have ADHD, they sort of become your natural pediatrician just because of their specialization.
Mm-hmm.
And they're just kind of your point person for a lot of things as your child grows and develops. Like, does my child need occupational therapy now or speech therapy? And they can kind of help work with you and troubleshoot on that. So it's great, but it also makes them in high demand and very busy because there aren't a lot of them out there. So that's a great point. So just to wrap up, again, a developmental pediatrician is very similar to a pediatrician in their evaluations. They just have more specialized training in ADHD or some of those other diagnoses.
One thing I hear from my friends is that their kids often think boring tasks like chores or homework are going to take forever. And in the same breath, their kids can play 2 hours of Minecraft and then complain that they just got started.
Okay, I think that friend you're referring to might actually be me.
I'm not naming names. One tool we all love and have in our own homes is Time Timer.
At this point, I think we all have multiple time timers. For kids with ADHD, time can be a very abstract concept, and Time Timer helps by making time more concrete. It helps kids visually see the passage of time.
And it can prevent those inevitable meltdowns when 2 hours of Minecraft just wasn't justification enough to ask your child to complete 5 minutes of chores.
From homework to chores to screen time to daily hygiene to our own work, we love Time Timer because it is so versatile and their designs are cute too. A staple in our homes.
If you have a child with ADHD, we know you need a Time Timer, and we have a discount code for you to use. So head to timetimer.com and use the code TCC to get the discount. You can also find the link and code in the show notes.
So the third type of specialist that you may encounter, maybe when you're Googling or asking friends for advice, is a psychiatrist or a psychiatric nurse practitioner. And the great thing about psychiatrists and psychiatric nurse practitioners is that they have very in-depth knowledge about childhood and adolescent mental health diagnoses. So they are very well equipped to look into things like anxiety, depression, mood disorders, to get kind of a bigger picture look at what's really going on for your child. Another advantage is that as medical providers, they can prescribe medication and help you with medication management, especially for those more complex kiddos who may be on several medications for several different things. A drawback, however, they often do that med management, but most of them do not do counseling or therapy or like parent training kind of support. So a lot of times you'll be going to that person for the medication management, and you'll need another person to help you with, seek out all those extra treatments, other people to provide the therapy and things like that. Another advantage is that generally psychiatrists are covered by your insurance, making it a little more accessible to you. Can get very pricey if you're paying out of pocket, however. While psychiatrists are very well versed in a lot of these childhood mental health diagnoses, they're usually not trained in evaluating for learning disorders. A lot of times they can't do evaluations for autism spectrum disorder. So if you have concerns about your child's learning, their socialization, things like that, they may not be able to do a fully comprehensive evaluation to get at all of your concerns. Oftentimes, psychiatric visits are very short. They're not going to be doing super in-depth evaluation when it comes to like having you do a lot of those rating scales that Lori was explaining, direct testing with your child. Most of their diagnoses are based on interview with you and with your child. So they can get they're very good at getting information about a lot of these concerns, but they're not going to do super in-depth testing to tease it all out if it's a really complicated child generally.
Yeah. And I would kind of add, though you can definitely find psychiatrists that are covered by insurance. I know a lot of psychiatrists in our area are not. And again, it does cost a lot of money. Like I had a mom call me the other day that was like, I was on the clock for 20 minutes and it's $300 and I wanted to ask her these questions, but I couldn't fit them in. So sometimes those meetings are short and expensive, again, if they aren't covered by insurance. So that's definitely a drawback at times.
Yeah. And a dynamic that I sometimes see as well is families are seeing the psychiatrist as that like kind of initial diagnosis and prescription for medication, but sometimes then the psychiatric nurse practitioners step in for the med management, and that can make costs a little bit more manageable for families, a little bit easier to get in with them. But that's very like practice specific, but sometimes I see that dynamic.
Yep.
So to summarize, psychiatrists or psychiatric nurse practitioners may be someone that you come across in the diagnostic process, and they have a lot of in-depth training when it comes to childhood mental health concerns. They can give that diagnosis, and then they can be your prescribing provider. But if there's concerns about your child's learning, they're not going to do super in-depth testing to really tease out all of those concerns.
Yep. So the fourth specialist is a psychologist and/or neuropsychologist, would be myself or Mallory. So that is kind of where, when Mallory was practicing in my practice, we specialize in those comprehensive evaluations for ADHD and things like dyslexia or anxiety, depression, autism. When we do testing, it is a lengthy process. So again, I meet with parents for an hour to an hour and a half. We do testing with kids over the course of 2 days, usually 3 hours each day, sometimes more, sometimes less, depending on their age. And then the reports that we write are very comprehensive. We spend, an hour to an hour and a half after those evaluations meeting with families to really make a plan for how to support them, understand those diagnoses so that they can kind of walk away with knowing like what are the priorities, from going forward of like how to help my child. A lot of times those evaluations also really can be helpful in giving more specific and detailed information with regard to like accommodations at school. So many families are like, I don't know what accommodations my child with ADHD needs at school, or what's the best plan of support for them. So a lot of times those kind of in-depth evaluations really give you a lot more guidance on what specifically you need to kind of help your child be successful, not just at home, but also at school. those evaluations, because they're so lengthy, are expensive. So not going to lie about that. There are some psychologists that do those evaluations through insurance. So sometimes it can be covered by insurance. But a lot of times it isn't, just because insurance isn't going to cover things like academic testing. They feel like that's what the school should be doing, which can be very frustrating for families. The other thing is long wait lists. So like right now, it's 5 to 6 month wait to see me or other psychologists in the area for those kind of in-depth comprehensive evaluations, just because there aren't a lot of people who are doing that and specialize in those areas. So that's definitely a drawback. The other drawback to kind of think about too is I don't do medication. I don't specialize in medication. My specialization is more behavioral and social interventions and support. And so I might give parents recommendations based on the research for medication. But if they need medication management, they're going to have to go back to someone like their pediatrician or a psychiatrist or a developmental pediatrician for that medication management piece. So a lot of families I know get confused about psychologist versus psychiatrist. And that's kind of the big difference is I am not a medical doctor. I do not do medication. So if there's kind of medical concerns, you have to see a medical doctor, which would be a psychiatrist.
It's such a confusing process for families. And thinking back to when I was still in practice and doing these evaluations, and Lori, you probably still get these calls. Families would call in and I'd ask them, what their concerns are and what they're looking for. And a lot of times they're like, I don't really
Yes.
know. I
Mhm.
don't know what I'm looking for. Am I looking for an evaluation? Am I looking for treatment?
Yep.
Are you the right person to do that? So if you're feeling a little lost and confused, you're not alone.
Yep.
But I love when parents would, get the courage, give us that call, tell us they're not so sure what they want, because then we
Yep.
could help them understand, like, are we the best provider to help them reach their goals, like based on what their concerns are. But
Yep.
if you're feeling lost in this process, you're not alone. It's confusing.
I think the other piece for families that are thinking about those long wait lists, a couple like just quick tips on that. So one is if you're listening to this episode and you're like, I definitely know that I want an evaluation, you might want to put your name on a few different wait lists for evaluations. And it can be a lengthy process, which is kind of the downside because you have to fill out intake forms a lot of times before you can even get scheduled. But it's probably worth it because I know like in the practice that I worked at, which was a psychology office mostly, they would call families and say, hey, we had a cancellation, especially once COVID happened. And it was like, we were so strict on our sickness policy. So if families had any illness at all, they would cancel their appointment. And then we could call other families and have them come in sooner. So don't totally lose hope. But the other piece of that equation is if you have even really like what I would consider mild concerns, it makes sense to get your name on the list. So a lot of families wait until things are just in a really hard place. And I get that. Like as a mom, it's like I'm putting out fires like right in front of me. But I think the encouragement there is, hey, like my daughter, she's coming up on 4th grade next year, which is crazy. But as I think ahead to that and I'm like, okay, what is she going to need to be successful in 4th grade? And for a lot of families who have a child who's going into like one of those kind of big jump grades, it can be really helpful to start thinking about getting an assessment already scheduled. And worst case scenario, you get 3 months, 4 months down the road and you think, wow, things have gotten a lot better. We'll just cancel that appointment. But it would be much harder to be on the other side and say, okay, we waited and now things are really, really difficult. And now I have a 6-month wait. So just kind of when in doubt, really looking to schedule and set up those appointments can be very helpful as like a peace of mind.
Yeah, and I want to kind of say not all kids need that type of in-depth comprehensive testing. Many kids in many situations are really showing just those ADHD symptoms and they're, getting good grades at school. There's no academic concerns. They have friends, like things are going well. It's just that particular area. And you really probably don't need a full evaluation. If you're kind of not sure, talking to your child's teacher and meeting with them to ask questions about their concerns there is helpful. Then meeting with your pediatrician to kind of talk through, is that needed? And I know I, along with other psychologists, offer kind of, brief 10-minute phone consults to kind of briefly talk you through whether or not that's needed. And I can tell you, I have many of those where I tell parents, I don't think you need a full evaluation for whatever reason. So sometimes that can save parents a lot of time or give them kind of direction a little bit more quickly. So if you're just kind of unsure, that's always an option too.
I love
So
that.
so to kind of wrap up again, psychologists do not do medication, but we do comprehensive testing and evaluations. And again, it's not always necessary for every child.
Perfect. So, our fifth person that can diagnose and really help you if you're trying to decide if your child has ADHD would be a therapist of some kind. So, we're thinking like counselors, social workers, family therapists, and these kind of therapists, not just family therapists, these kind of therapists can specialize in individual therapy. They can do family therapy, parent training, social skills interventions, and they are going to be the people that you see regularly, right? So often you're in some sort of a therapeutic relationship with this person, and they've observed your child, they've talked with you on a regular basis. So they're often able to look at other diagnoses that would go along with this, things like anxiety or depression, but they do not do a lot of the other levels of testing. So things like academic testing and that sort of thing. And it's really important when you're thinking of your therapist to figure out what level of expertise they have in ADHD. Not every therapist is qualified to diagnose ADHD. So you want to make sure it's someone who really has that training and that understanding of what they're really looking at.
Yeah.
I would say a common dynamic that I would see when I was practicing is maybe parents have concerns about, let's say, their child's emotion regulation and their attention span. So they seek out the help of a therapist. Maybe they find a play therapist, or they find, a counselor in their area, and they start to get some support. Over time, that therapist or counselor gets to know the family and the child, obviously, and they start to see some of those same signs that their parents are reporting. Then they advise the family to go get a more in-depth evaluation based on their observations. And I love when therapists do that. Kind of, I've known this family for a long time. These are the things I've seen. This is why I'm referring this family to you as a psychologist for this comprehensive evaluation. Please look into these things. So I'd say that's a pretty common dynamic we see too, and that's perfectly fine. Many families seek the help of a therapist or a counselor before they get an official diagnosis.
Yes.
And I think that's something that parents are unsure about as well. Like, do I need an official diagnosis to get help? And the general answer is no. You can find a therapist or counselor who, without like putting a name to it, can learn more about what your family's concerns are and start to treat. Getting to know your family over time, then they may make that diagnosis, or they may refer you to someone who will make that diagnosis for you.
Yeah, I would say that that's a really common situation for me as well. I work with a number of therapists that again will work with families and be in a relationship with them, and then after kind of working with the kids or maybe not making the progress they had hoped. I was just interviewing a therapist the other day, and right off the bat she was like, something's different in this situation and with this child and how she sees the world and things like that. And I've worked with lots of kids with ADHD, but there's something else I feel like going on where I'm not making the progress that I want. I don't know why, and maybe she needs something different.
Mm-hmm.
So I think, again, they can be really helpful in that way. I know that there are in the Phoenix area a couple of people that I know that are therapists that really don't like specialize in ADHD. That's like kind of all they do. And so they feel a little more comfortable in doing some of those assessments for ADHD because that's their specialization. But I also work with them in the capacity of some of those kids maybe have ADHD, but they're seeing other things that could be going on with them. Like they're really struggling at school and they're wondering about learning concerns. Or they're seeing things that might make them think it's autism, and could they get more resources, if they had that diagnosis. So those are kind of common situations.
Yes. And keeping in mind that the therapists are not going to be able to prescribe or manage medication. So if they did diagnose ADHD and say, you might want to talk with your doctor about getting on medication, that would be a referral back to your child's pediatrician or a psychiatrist for that. In terms of the cost, therapy, I would say, is kind of a mixture, at least here in the Phoenix area. There are therapists that take insurance, and then you would probably have a copay or a deductible or something. And then there's a lot more therapists here in our area that are going to a private pay model only. So that's kind of a different model, because you're not really coming in for like an assessment with your therapist. You're going in for probably more like ongoing treatment.
So to wrap us up today, I think it's important. We really want you to know that there's not a right or a wrong way to get an ADHD evaluation. Families feel like they really need that big in-depth evaluation, but as Lori was saying, that's not necessary for all kids. There's not one right or wrong. It really depends on your child and their needs, and having this conversation with your child's school or your child's pediatrician, discussing the pros and the cons of all these different specialists, considering your finances, your insurance, your child's level of support needs. Have those professionals help guide you in terms of who do I seek out for that evaluation. And sometimes families kind of take the tiered approach where they start with the pediatrician, they get that diagnosis, they do meds, they feel like something more is needed. Then they go to the developmental pediatrician, or then they go to the psychologist. So you can kind of take it, in steps. If you are talking with the school, you're talking with your child's pediatrician, and you really feel like your child needs that more comprehensive evaluation, ask your pediatrician or the school for referrals for people who really do ADHD well in the area, and hopefully they have someone to send you to. As we were alluding to, though, when it comes to therapists and counselors, you don't necessarily need that diagnosis to do something about it yet. And on that note, I just wanted to mention that if you're looking for strategies and tools kind of in the meantime, en route to the diagnosis, we do have a free ADHD parenting guide. It's called 6 Keys for Raising a Happy and Independent Child with ADHD. We get families messaging us all the time like, my child doesn't have a formal diagnosis. Would this guide help me? We really think it will. ADHD diagnosis or suspected ADHD. So we'll drop the link to that in the show notes for you. So be sure to grab that. And as always, we're here to support.
Thanks for listening to Shining with ADHD by your hosts, Lori, Katie, and Mallory of the Childhood Collective.
If you enjoyed this episode, please like this video and hit subscribe so you can be the first to know when a new episode airs.
If you are looking for links and resources mentioned in this episode, you can always find those in the show notes. See you next time.